So today I'd like to talk about updates on Guillain-Barré syndrome, focusing on treatment development for GBS. Based on my experience that I have been involved in development of eculizumab for GBS for these 10 years. This is my COI disclosure. This slide shows the agenda of my talk. Firstly, I would like to briefly summarize the prognosis of GBS to clarify unmet needs in treatment for GBS. And then I'd like to introduce the current evidence about the efficacy of second dose of IVIG for severely affected GBS patients. And finally, I'd like to share the advance in new treatment development in GBS. Let's start with the overview of the prognosis of GBS. As you know, GBS is characterized by acute ascending paralysis, typically after preceding infection such as C. jejuni. And the clinical course of GBS is known as self-limiting, so the progression will end within 4 weeks, even without any treatment. Some patients remain mild throughout their course. However, there are some patients who develop severe tetraplegia and respiratory failure that lead to neurological sequelae in the future. The current standard of care of GBS are immunoglobulin and plasma exchange. And in Japan, immunoglobulin is the mainstay of standard care. However, with these standard of cares, the prognosis of GBS is not necessarily unfavorable. The mortality rate is approximately 5%. And 20% of the patients need ventilation during their acute phase. And 20% of patients cannot walk independently even 1 year after the onset. And on top of that, 40% of patients should change their job after GBS. GBS affects all ages, including kids and young adults. So neurological sequelae have a significant impact on their life. So these numbers cannot be ignored. The current standard of care was developed in 80s and 90s, so they are very old treatment. Then many drugs have been developed. However, all of these clinical trials failed. So there have been no significant advance in development of treatment for GBS so far. So let's move on to the topic about the efficacy of second dose of IVIG. Second IVIG is recommended for severely affected GBS patients, but the evidence was not so robust. The recommendation was based on this case series published on Lancet in 1990s. So the Netherlands group performed an RCT to investigate the efficacy and safety of second dose of IVIG. Patients were firstly treated with IVIG, and on day 7, they were evaluated using Modified European GBS Outcome Scale, a prognostic score. And if they scored 6 or more, meaning their prognosis might be poor. So they were allocated to the second IVIG group and the placebo group. And on week 4, the primary outcome was evaluated. Finally, 49 patients were allocated to the second IVIG group and 44 patients to the placebo group. This slide shows the result of the clinical trial. The primary endpoint was a disability score at 4 weeks. As you can see, there was no difference between the second IVRG group and the placebo group. And moreover, this study pointed out the safety concern about the second dose of IVRG. Over half of the patients treated with the second IVIG developed serious adverse events during the study, and mostly thrombotic events such as coronary ischemia and TIA. So they concluded that second IVIG should not be considered to treat severely affected GBS patients. And they also mentioned that there is a need for new treatment trials. So let's move on to the last part about advancing new treatment for GBS. There are two types of drugs in development for GBS. One is IDES, IgG degrading enzyme of Streptococcus pyogenes, and monoclonal antibody to complement components, such as C5 and C1q. And they have their mechanisms are all different. However, they are supposed to suppress activation of complement pathways. So monoclonal antibodies to C1q and C5 is supposed to suppress the activation of a classical pathway and the final pathways of complement activation. And C3 and the IDES is supposed to cleave immunoglobulin. And C3 cannot deposit to immunoglobulin, and complement activation cannot be occurred. So in axonal Guillain-Barré syndrome, the involvement of complement activation was clearly shown. And anti-ganglioside antibodies and complement pathway activation leads to formation of membrane attack complex and reversible axonal degeneration. As for the demyelinating form of GBS, the involvement of complement activation has not been clearly shown yet. However, a previous study showed the position of C5b29 membrane attack complex around myelin in autopsy case. So also in demyelinating GBS, complement activation might be involved. And a previous study investigated that eculizumab prevents anti-ganglioside antibody-mediated neuropathy in a Mullin-Miller Fisher model. Eculizumab is a monoclonal antibody to complement C5. Eculizumab prevents the disruption of the nerve terminals, and it also prevents respiratory dysfunction compared with control. So in both axonal and demyelinating GBS, there might be a number of pathologic cascades, and they converge into the final cascade of activation of a complement, and it leads to development of severe nerve damage. So inhibit here just prior to irreversible severe nerve damage can be a good strategy to treat GBS. So I'd like to introduce the status of development of IDES. IDES is originally secreted by Streptococcus pyogenes, and it cleaves immunoglobulin into FC and FAB portions. And this study investigated the efficacy of IDES in a vitro GBS model. IDES cleaves C3 portion, FC portion from anti-GM1 ganglioside antibody, and C3 complement C3 cannot deposit to ganglioside antibodies. So complement activation cannot occur. So IDES has been developed by Hansa Biopharma, and this is their recent press release. They reported that they completed enrollment in the phase 2 clinical trial of IDES imlifidase in GBS. And they also mentioned that top-line data is expected to be shared during the second half of 2023. So we will see the results of this phase 2 clinical trial very soon. And I'd like to share the status of development of eculizumab. Eculizumab is a monoclonal antibody to complement C5. It was approved to myasthenia gravis and neuromyelitis optica in our field, so we are getting familiar with eculizumab recently. Eculizumab inhibits cleavage of C5 and formation of membrane attack complex potently. So we performed a phase 2 clinical trial to investigate the efficacy and safety of eculizumab for GBS since 2015 in Japan. We enrolled GBS patients who cannot walk independently within 2 weeks from the onset. All of them were treated with IVIG, and they were allocated to the eculizumab group and the placebo group. We finally enrolled 34 patients, and 90% of them were wheelchair or bed-bound, meaning they are very severely affected. This slide shows the primary endpoint of this study. The primary endpoint was the proportion of patients with restored ability to walk independently on week 4. Unfortunately, the proportion cannot meet the pre-specified level of success, so this trial was a failure. However, we saw the tendency of efficacy with eculizumab. 90% of patients treated with eculizumab can walk independently within 24 weeks. And this slide shows the most striking result of this study. So almost 70% of patients treated with eculizumab can run within 24 weeks. So we thought that eculizumab might be effective for GBS. So this trial was phase 2 clinical trial. So we prepared and started phase 3 since February 2021 in the middle of the COVID-19 pandemic. And we finally enrolled 57 patients. And however, unfortunately, that clinical trial failed. So at this time, I cannot share the detailed result of this study. However, surprisingly, most of patients in the placebo group can run within 24 weeks. So most of enrolled GBS patients, prognosis of them was very good. So we are preparing the paper now. So we will publish the paper soon. And what do you think happened to the development of eculizumab for GBS? Eculizumab may be not effective for GBS, in fact. However, we have one speculation that the pandemic substantially influenced on the epidemiology and the pathophysiology of GBS. GBS is caused by antecedent infection, and we conducted the clinical trial in the middle of the pandemic. And this slide shows the changes in number of GBS patients in Japan. As you can see, the number of GBS patients steeply decreased in Japan in 2020 when the COVID-19 pandemic occurred. This might be associated with changes in the status of public health, such as lockdown and washing hands. And people in Japan did not go eat out during those times. So this slide shows a number of outbreaks of food poisoning in Japan. In 2020, the number of outbreaks of Shigella steeply decreased. So there is a possibility that the proportion of the preceding infection changed during the COVID-19. Moreover, recently, some reports, some papers reported the association between COVID-19 and GBS. This meta-analysis study estimated the prevalence of GBS is 15 cases per 100,000 COVID patients with COVID-19. So COVID-19 might be a new antecedent infectious agent of GBS. And it might be associated with the demyelinating form of GBS. So under the pandemic, there might be changes in antecedent infection from C. jejuni to something. And COVID-19 might be associated with GBS. And at this time, we don't have any data about COVID-19 associated GBS, such as prevalence and the clinical course, prognosis, and the pathophysiology. So we are preparing to restart of research of GBS. So we are preparing to investigate biosamples from P2 and P3 of eculizumab study. P2 study was performed before COVID-19 pandemic, and P3 was performed in the middle of COVID-19. And we are also preparing nation survey to investigate the prevalence and the prognosis of GBS before and after COVID-19 pandemic. And we also prospectively collect the data, prognosis data of GBS using our registry system. So in conclusion, the efficacy of second IVIG for severely affected GBS patients was negative. And the recent study pointed out the safety concern about the second dose of IVIG. And novel treatment development is underway. So, but our trial of eculizumab failed. But I don't give up. So I will continue my research to conquer GBS. Thank you for your attention.